think it's important to begin with kind of the history in that both of us began our professional careers as physical therapists, and Greg in the early 1970s, 1971, and myself in 1977. And as we worked with patients doing traditional physical therapy, we began to realize that there were some holes in the care that we wanted to give our patients. So both Greg and I had our beginnings as physical therapists at the Kaiser Vallejo program. Greg for 7 years, me in the 6-month residency. That program was primarily directed toward the treatment of neurologically impaired patients. We did see orthopedic patients, but our focus there was the neurologically impaired patient. Someone who'd had a stroke, someone who'd had a head injury. When you're working with this type of a patient, you're looking at function. If someone walks into our clinic and they're complaining of back pain, the typical physical therapist zeroes in on, I've got to get rid of the pain. But a functional manual therapist, because of our history, the first thing we look at is, well, how does that person with back pain walk? How does that person with back pain get up and down from a chair? Because we've been trained from the very beginning to look at function. And we've realized that by examining and analyzing one's function, that helps you to determine the true source of their pain or their disability. So in the early days, we focused primarily on movement reeducation. Then as we began to study in the physical therapy profession and we learned all about joints and how to mobilize joints, that took us to a next level. We realized that you had to have mobile joints in order to move your body, and there were techniques of mobilization that really helped. But then in the mid-70s, Greg began to realize something was missing entirely from our profession. And that was the addressing of the soft tissue or the fascial system of the human body. And in the mid-70s, there were people outside of our profession that looked at this, but no one within the medical or physical therapy profession looked at the fascial or soft tissue system. And so Greg in the mid to late 70s said, this is something that we should be treating as physical therapists. And he basically introduced to the physical therapy profession, first in the U.S. and then throughout the world in several other countries that he's presented in, the whole concept of soft tissue mobilization. Well, that was just the beginning, because as we begin to look at the integration of the soft tissue system with the joint system, with movement, we began to realize that our training philosophy needed to change. In the early 1980s, there were all around the world several locations, Australia, Scandinavia, and the U.S. in Northern California, people began to talk about stabilization. We didn't even use the word core back then. It was just stabilization. And our contingency in Northern California was the only one that had come from this function-based background. And so instead of just looking at having patients cognitively or actively brace and stabilize, we began to look, how can we facilitate the body to automatically engage its core? Because that's what is normal about the human body. And VARDÀN is the only clinic in India that will offer the services of functional manual therapy and of certified functional manual therapy.